Hey guys, welcome back to Loop Hub. Today we'll talk about the most disgusting moments on Dr. Pimple Popper. Let's head into it. Number 1. Mount Gushmore. Fans dubbed Dr. Pimple Popper's cyst pop Mount Gushmore because it was so pleasurable. Dr. Sandra Lee checked the patient's silver dollar-sized cheek cyst in a YouTube video posted last Wednesday and stated it felt hard. Skin cysts can occur for two causes. Some arise when skin cells burrow beneath the surface and multiply, forming a sac filled with keratin, a yellow liquid-like substance. A cyst can also form when oil produced by skin glands become trapped beneath the skin, generating a thick, cheese-like material. Lee said in the video that she initially saw a picture of the man's cyst in June, and that by his checkup in late October, it had grown dramatically. When I looked away, it just squirted a little, like it was speaking up, Lee said. She then got to work. Lee used a small blade to make a little incision on top of the cyst to treat the man. It immediately ejected a thick white material because the cyst was under pressure due to inflammation. Lee said the reaction happened swiftly. Lee used her fingers to squeeze on both sides of the cyst orifice after it had emptied a little on its own. More pus, as well as a tiny amount of blood poured forth. The fat mass was then held in place by a sac inside the cyst, which Lee had to remove. She then described the situation as problematic, since the patient's body liquefied the cyst, making it difficult to locate the sac. Lee was able to clip away the sac and sew up the incision with the help of a blade, tweezers, and scissors. Because the incision was nearly half an inch deep, Lee also gave the patients antibiotics to avoid infection. Number 2. A waterfall cyst. Dr. Sandra Lee revealed one of her favorite treatment videos of all time on Thursday, in which she drained the patient's orange-sized back cyst. The patient had an epidermoid cyst, which is a form of cyst that occurs when skin cells burrow and grow beneath the skin. Epidermoid cysts usually grow slowly and are not unpleasant. The cyst had turned inflammatory and purple in this case when it burst beneath the skin, despite the fact that the cyst isn't diseased. Lee says she refers to burst cysts in this manner, since it's the simplest way to describe what happens to patients. When an epidermoid cyst ruptures, it triggers a strong foreign body inflammatory reaction. The skin becomes warm, tender, painful, and swells, imitating an abscess. Lee recommended that the patient use a warm compress to the irritated cyst for 2 days to relieve the irritation. Lee then injected a numbing medication into the back cyst in her office. She poked the cyst with a little blade, and liquid pus and blood poured out of its center like a cascade. Lee pressed her finger above the incision she'd made, and the growth poured even more pus and blood. She said, "Gosh, it wants to come out." The cyst size began to decrease as the pus continued to drain for another 5 minutes. The treatment procedure, according to Lee, relieves pain and inflammation nearly instantly, and antibiotics aren't required after the cyst is emptied. Lee made a few more small cuts to allow more pus pockets to drain from the tumor, and her assistant gently kneaded the region with her fingertips to encourage the liquid to drain. To collect extra fluid, Lee placed a thin strip of gauze in the openings of the incision. Excess fluid can cause an infection, she said. She informed the patient to return in a few days to check on the incision, and that as the cyst inflammation decreased, she should start to feel less pain and suffering. Number 3. Slippery chicken. The dermatologist located in California demonstrated how to remove a big fat-filled growth off a patient's back on Monday. Lee stated in the video that she will be removing a woman's lipoma, which is a sort of tumor found between the muscle and skin layers. Lipomas usually grow slowly and are modest, with a diameter of around 2 inches. This woman's lipoma, on the other hand, was quite large, and Lee referred to it as her giant lipoma friend. Dr. Pimple Popper numbed the patient's back, where the lipoma was located, in order to remove it. She then made a 5-inch incision, which revealed the fat within the growth right away, and continued to cut at the fat to separate it from the woman's body. Lee described the growth as slick after attempting to pull the fat out of the wound with her fingertips. With just her hands, she was able to remove half of the fatty mass, which resembled raw chicken. She did so with the help of her hands and scissors. She compared the maneuver to giving birth to a baby because she was able to get the majority of the fat to the surface of the woman's skin with one huge squeeze. Dr. P revealed a fat-free void that was left after the lipoma was removed and stitched it up to heal. This brings us to the end of our video. I hope you enjoyed it. Hit like if you did, and don't forget to subscribe to our channel so that you don't miss any of our videos in the future. Also, watch the 2 videos that are on your screen because I'm sure you'll love them. With that, I'll see you in the next video.